We see rapid rise in these STI'S. Is it because of unawareness or తెలిసి కూడా చేస్తున్నారా?
అట్లని మళ్ళీ అందరు ఇది ఇంకో మిస్కన్సెప్షన్, సిటీ పిల్లలు చాలా ఫాస్ట్. నథింగ్. ఐ గెట్ మోస్ట్ STI'S ఫ్రమ్ విలేజెస్.
Ma'am, ఇప్పుడు natural delivery are like becoming very rare. Most of them are preferring cesarean.
You won't believe, in 3 years we removed 57 uteruses. In 3 years. That is a lot. These are all young women in there. So I talk to women who are 20s only. You take care of your fertility from now, not when you're married, when you're above 30, when you're planning a child. Appudu overnight raadu general health.
And ee madhya there are many celebrities who are saying like freeze your eggs and do your and మీ dreams అన్ని complete చేసుకోండి. How viable?
But again, it's not a guarantee that, whatever eggs are there will always lead to a pregnancy. Because again, you're adding a sperm into the picture. Now, the quality of the sperm also matters.
Good morning, ma'am. Welcome to the podcast with Team Advitam.
Thank you.
Yeah. Ma'am, ఈ మధ్యకాలంలో ది మోస్ట్ కన్సర్నింగ్ థింగ్ ఏంటంటే మెడికల్ గ్యాస్లైటింగ్.
Yes.
So, feeling dismissed with family and even doctors.
Yeah.
How do women deal with this?
So, medical gaslighting, for those who don't know what it is when a patient is telling some symptoms to the doctor. And the doctor is dismissing it as it is nothing serious, it's nothing to worry, or just like the patient feels that she is only overthinking this. The doctor says that it's all in your head, or you're overthinking this, you're an anxious person, it's nothing, there's nothing to worry. Itla conversations jariginapudu, that is called medical gaslighting.
Okay.
So the patient starts to feel that she feels unheard.
Correct.
Or she feels like, okay, maybe this is nothing. Then she starts going to that self doubt. And ఇది ఎక్కువగా old people and women face this more. In general in the society, when old people say something or women say something, it tends to get dismissed a little bit. So that's what happens in the medical field also. And doctors may do it unintentionally also. So
sometimes భరోసా ఇవ్వడానికి kind of.
Yeah, there are again some patients where they do actually overthink about one particular thing. Adi kuda undi. You just need to differentiate between what is a real problem and what is actual something that is not of a big concern. Correct. And can be left. Adla.
What are the most common silent symptoms that women often ignore?
మీరు మీ ఇంట్లోనే చుట్టుపక్కల వాళ్ళలోనే కామన్గా లేడీస్తో వినుంటారు బ్యాక్ పెయిన్.
Correct.
Most women say back pain. Okay. Now, back pain there are hundreds of reasons for back pain. It starts from simple not having a strong toned muscles in a woman's back. So, muscle strength lekunda, balam lekunda em panlu chesina kuda back pain vachestadi. దానికి ఇంకేం ట్రీట్మెంట్ అవసరం లేదు. బట్ దెర్ ఆర్ ఉమెన్ హూ హ్యావ్ క్రానిక్ పెల్విక్ కండిషన్స్, like uterus related issues gani, ovary related issues gani, spine related issues gani, which were never treated. Andaru back pain antunaru kada, idigo ade emo ani they tend to ignore it. So this is one common area, one of the examples basically. These kind of symptoms ilanti areas lone ekko gaslighting jarugutadi. So there are some things patients can do to address it. Suppose if she took rest, it should go away, right? If it still didn't go away, that means there's definitely something going on. So ఈ gaslighting avoid చేయడానికి పేషెంట్స్ చేయగలిగింది ఏంటంటే వాళ్ళ సైడ్ నుంచి they can list out log your symptoms properly. When did it exactly happen? What reduced it? What increased it? Did you use some medication? How far did it help? ఈ ఇన్ఫర్మేషన్ అంతా ఇవ్వగలిగితే then the doctors also might understand more about what exactly is happening. సో నడుము నొప్పులు అంటే ఇంట్లో మనమే విన్న వాళ్ళమే ఇగ్నోర్ చేస్తాం చాలాసార్లు. సో దీస్ ఆర్ వన్ ఎగ్జాంపుల్ వేర్ ఇలాంటి సిమ్టమ్స్ దగ్గర అండ్ రిపీటెడ్లీ ఇఫ్ అ వుమెన్ ఇస్ సేయింగ్ దిస్ అగైన్ అండ్ అగైన్ దెన్ ఆల్ ద మోర్ పీపుల్ విల్ థింక్ దట్ మేబీ ఇట్స్ నథింగ్, బికాస్ దానివల్ల ఏం కాలేదు కదా, షీ ఇస్ ఫైన్ ఓన్లీ కదా స్టిల్ అని, దట్ టెన్స్ టు గెట్ ఇగ్నోర్డ్ అ లిటిల్ బిట్ మోర్.
అంటే వన్ టైం వస్తే ఓకే, బట్ రిపీటెడ్ గా సేమ్ ప్రాబ్లం వస్తుంటే డెఫినెట్లీ దేర్ ఇస్ సమ్ రాంగ్.
Yeah, log the symptoms correctly, and obviously if you feel that your doctor is dismissing your symptom, then you take a second opinion.
Correct.
From your end, yes, you log in the symptoms properly, you'll observe everything, put it to the doctor. If the doctor hasn't been able to come to a conclusion as to what it is, always seek a second opinion.
Correct.
ఒక చీర కొనాలంటేనే ఆడవాళ్ళు 4 షాపులు తిరుగుతారు.
Mm.
Why not take a second opinion? I am one doctor who always advocates second opinion. Even my patients, you are getting a doubt with me, go take another opinion. Then you'll know for sure if you're getting the right thing or not.
Actually, అంటే we should normalize taking second opinion.
We should. In everything in life, we take second opinion.
Correct.
అంతే కదా.
Yes. Ma'am, we see sudden, rapid rise in these STI'S.
Yeah.
So, is it because of unawareness or తెలిసి కూడా చేస్తున్నారా kind of?
రెండు ఉన్నాయి. There is unawareness. You won't believe how much unawareness is there in educated, population also. So we are not even talking about very low income strata of the society. We're talking about even like proper. Educated, middle income, high income category brackets also. Even there is a lot of unawareness. Plus, yes, ignoring it is also there. రెండు ఉన్నాయి, both are there. So unawareness అంటే ఏంటి? They think that sexually transmitted infections అంటే it is something like HIV. కాండం వేసుకుంటే సరిపోతుందా? బట్ దే డోంట్ నో దట్ దెర్ ఆర్ సో మెనీ అదర్ సెక్షువల్లీ ట్రాన్స్మిటెడ్ ఇన్ఫెక్షన్స్. బ్యాక్టీరియల్ ఇన్ఫెక్షన్స్ ఉన్నాయి, వైరల్ ఇన్ఫెక్షన్స్ ఉన్నాయి, ఫంగల్ ఇన్ఫెక్షన్స్ ఉన్నాయి. వైరల్లో కూడా అందరూ అగైన్ HIV అదొక వైరస్, అదొకటేనా వైరస్? దెర్ ఆర్ సో మెనీ. హర్పీస్ ఉంది. హర్పీస్ గురించి చాలా మందికి తెలియదు. హర్పీస్ కాండం వేసుకున్న పని చేయదు, వస్తుంది. సో పీపుల్ షుడ్ నో దట్ ఇఫ్ దే ఆర్ హ్యావింగ్ సమ్ సిమ్టమ్స్, గెట్ ఇట్ చెక్డ్, గెట్ ఇట్ ట్రీటెడ్. దెన్ యూ వోంట్ బి పాసింగ్ ఇట్ ఆన్ టు పీపుల్. Then it goes from one to the other, there to there, there to there. చిరంజీవి సినిమా లాగా ఒకరికి ముగ్గురికి 6కి అన్నట్టు it just keeps spreading.
Correct.
They don't know. And we should not be in a misconception that people are in monogamous relationships anymore. We should not have the misconception that marriage ainake people are sexually active. People are sexually active even otherwise. We are seeing people being sexually active in late teens and very early 20s also. So assume that, if you have an adolescent, to teach them sexual education, tell them about, protection. Yes, there should be.
Correct.
And they think that it's okay, I'll just take an eye pill.
Correct.
It's okay if I'm sexually active, I'll take an eye pill. You're not just trying to prevent pregnancy here. You have to prevent a wide, long list of symptoms and, long list of infections, basically.
Which age group you are observing? అంటే మీ దగ్గరికి వస్తుంటే
20 to 30. Highest is 20 to 30. అట్లని మళ్ళీ అందరు ఇంకో మిస్కన్సెప్షన్, సిటీ పిల్లలు చాలా ఫాస్ట్ అని. నథింగ్. ఐ గెట్ మోస్ట్ STI'S ఫ్రమ్ విలేజెస్.
I think city people take some precautions.
Still being a little bit better in terms of precaution, yeah.
Ma'am, unlike before, ఇప్పుడు natural timelines తో సంబంధం లేకుండా people are planning pregnancy and even like delivery timings, like Muhurtham timing, Muhurtham delivery. So is it safe health wise?
See, Muhurtham deliveries ante, suppose if you want to go for a natural, normal delivery, then there is no point of having a Muhurtham. You don't know when a woman is going to get pains and if she's going to have labor for 6 hours or 36 hours. It ranges from person to person. Correct. So, atla unte no point of a Muhurtham. But if you're going to have a planned cesarean, like if you previously had a cesarean and this time also there's no chances for a normal for you, you still have a planned cesarean, then yes, you can pick a date. But see, we wouldn't advise that for everybody because Marco in the hospital, we have a lot of trouble with Muhurtham sections. Suppose one patient comes and tells, నాకు 11 to 12 మధ్యలోనే కావాలి అని. Then we have to block that theatre for that person. సడన్గా మాకు ఇంకా ఎమర్జెన్సీ వచ్చేస్తే మాకు స్ట్రెస్ఫుల్ అది. Suppose our hospital has 3 or 4 theatres, let's say, already planned list of surgeries untai, we keep one theatre always empty for emergencies. But what is the guarantee that we'll get only one emergency? What if we get 2?
Correct.
So that's why we don't want anybody to opt for Muhurthams. Some people give 4 a.m, 3 a.m, Brahma Muhurtalu. And we don't want to wake up and come at 4 a.m if it's not an emergency. So yeah, it's never a good idea.
Okay. Ma'am, natural delivery are like becoming very rare. Most of them are preferring cesarean. And even some doctors and some hospitals are also. And even people they're planning to go for this cesarean or section.
There are multiple things. It's just unfortunate that women are leaning towards cesareans more. And again, they're in that feeling that, less pain, fast ga aipothundi ani. But that's not true. There are many ways to look at this. Just alone on this topic, we can talk for an entire day. See, obviously, natural birth is safe.
Correct.
Okay, because body was already designed for it. Agree that if things are not going according to plan, if we are seeing a risk for the mother, if we are seeing a risk for the baby, then we will do a cesarean. Cesarean is meant for to avoid risks, not as a normal. ఇది ఎలా ఉందంటే ఇప్పుడు జ్వరం వస్తే డోలో టాబ్లెట్ వేసుకుంటాము, అట్లా రోజు జ్వరం రాకుండా డోలో టాబ్లెట్ వేసుకుంటావా? It's something like that. So they are not understanding the difference between that. They think that kinda kutlu padtayemo doctor, I don't want that. They are so worried about that small 2 centimeter cut down there, which heals very fast. They're okay with a big 10 centimeter cut. With 7 layers. We're not just making one layer of 10 centimeter. We're opening 7 layers of 10 centimeters. So how many layers are we suturing? Scars form అయినప్పుడు లోపల అన్ని అతుక్కుంటాయి ఒకదానికి ఒకటి. How risky is that? And if you're in labor, there is an option of a painless labor now, which wasn't there say 2 decades ago. So now with the epidural analgesia antanga, with that option, you can comfortably have a normal delivery if everything is going smooth. If everything doesn't go smooth, we are not going to ask somebody also. Then we tell, no, this is where we are drawing the line. We are not going to take any more risk. We'll do a cesarean now. But direct cesareans, never a good idea. There is something called as తెలియని risks చాలా ఉన్నాయి. Placenta accreta spectrum అని ఒకటి ఉంది, which nobody would have heard of. So whenever a pregnancy is forming, embryo attaches into any corner of the uterus. Uterus is like a box, right? It can attach in any corner. So when we have done a cesarean for one woman, we have made a cut and we have stitched it. Akkada oka scar untadi. Next pregnancy, if it goes and attaches on that scar, then that is really, really, really risky. So the placenta invades into the uterine wall anamata. A maya anedi lopala deep ga bury ayi attach avutadi. That's how it snatches blood from the mother. So when this happens, it is burrowing into the uterus. It is burrowing into the patient's bladder. And we see a scenario where we have to remove the baby during cesarean and remove the entire uterus.
Okay.
Because it bleeds torrentially. ఆ bleeding ki solution ఏ లేదు. అవి కుట్లేస్తే తగ్గే bleeding కాదు. They bleed like tap. So that is becoming more and more common. With the number of cesareans rising, number of women having to get their uterus removed is also rising. So I worked, I was a head of department in one hospital in Old City, Koti Degra.
Okay.
In that area, certain religions, we see more number of, pregnancies and more number of cesareans. So we were seeing more number of third cesarean, fourth cesarean. You won't believe, in 3 years, we removed 57 uteruses.
Oh.
In 3 years. That is a lot. These are all young women in their 20 to 30 age group. ఇవన్నీ వాళ్ళకి అప్పుడు ఆలోచించరు. At that point, that mother is thinking, నాకు ఈ రోజు పెయిన్ వద్దు, let me just have a cesarean today. They are not thinking about the future consequences. There are so many women who regret it later. Then they come back and say, I should have tried little more, doctor. So
post operation infections gurinchi munde alocincharu. I mean,
yes, all the consequences. It's not just immediate post op. If you see next pregnancy is risky. Correct. Later in life you'll have chronic pelvic pain and back pain. Repeated cesareans and all scars untai lopala. Danto chronic back pain. Another thing.
Ma'am, for humans, whoever has habit of smoking and drinking, before they plan for a pregnancy, even a particular test lu avena teesukovala?
Smoking and drinking is never a good thing. Again, people ask me, how many cigarettes is okay? How many drinks is okay? No cigarette is okay. No drink is okay. Not a single one. So, pre-pregnancy ga ఏం చేయాలి అంటే, first thing is to completely quit. And if you ask me when to quit, how much gap should I give from the quitting to the pregnancy, I would say the longer the better. And smoking to issue ఏంటంటే, first of all, general health ki. You all already know heart health ki bad, lungs ki bad. Along with this, for a woman, it causes fertility issues. You might have smoked for 5 years and then stopped for 5 years and then had a pregnancy, but the quality of your egg, the quality of, the ovarian health is not very good. So miscarriage rates ఎక్కువ వీళ్ళకి, abortions అయిపోతుంటాయి రిపీటెడ్గా. Second thing is, if they have a pregnancy also, preterm labors, నెలలు నిండకుండానే పెయిన్స్ రావడము, or they'll have low birth weight, baby's weight is not adequate. These are all the risks of smoking. And even if you've smoked in your young age, later in life also that effects will be there. Early menopause and bones brittleness, osteoporosis becomes more. So it's fertility, it's hormonal imbalances, it's pregnancy complications, early menopause, and more menopausal symptoms, hot flashes ఎక్కువగా ఉండడము మామూలుగా అందరికీ ఉండొచ్చు, but these women who smoke can have much more.
Correct.
And brittle bones, osteoporosis, easy fractures, spine bend అయిపోవడం త్వరగా ఏజ్ వచ్చినప్పుడు 80కి రావాల్సింది 60కే రావడం, దీస్ కైండ్ ఆఫ్ థింగ్స్. సో స్మోకింగ్ ఇస్ నెవర్ అ గుడ్ థింగ్.
అంటే వాళ్ళు ఏదైనా పర్టికులర్ టెస్ట్ అలాంటివి ఏమైనా ఉన్నాయా?
సో ప్రీ ప్రెగ్నెన్సీ దేర్ ఇస్ నో పర్టిక్యులర్ టెస్ట్స్ ఫర్ స్మోకింగ్. But anyone who is planning pregnancy, smoking or not, should have a general health evaluation.
Okay.
So we call it a preconceptional check. So before they become pregnant, they have to come and get their thyroid checked.
Okay.
Unless you get a thyroid test, most women don't know that they have a thyroid disorder because it doesn't cause symptoms overnight. చాలా లేట్గా తెలుస్తుంది అనమాట. అప్పుడు వరకు డ్యామేజ్ అయిపోయి ఉంటుంది. సో థైరాయిడ్ ఎవాల్యుయేషన్ ఒకటి అవ్వాలి. Certain vaccines have to be taken before pregnancy. So those we usually give. We check women if they are obese. We check for sugars. We check for cholesterol. We check heart evaluation. So pregnancy is something where your whole body has to be healthy for it, not just your uterus and ovaries.
Okay.
So there is a very total evaluation that comes in there.
Vaccine అన్నారు, like it is like HPV?
No, HPV vaccine is a vaccine that should be taken when a woman is a virgin before sexual activity, or earliest she realizes after sexual activity starts. That is a completely different thing. That is another sexually transmitted infection which can cause cancers anamata. Dani prevention ke HPV vaccine is.
Okay.
So women who are trying to conceive, for them we give rubella vaccine. Rubella is a virus. If it comes during her pregnancy, it comes as a simple flu. Simple flu laga vastadi rubella. But if it comes during pregnancy, it can cause lot of effects on the fetus inside.
Okay.
Heart issues, cataracts, blindness, head development takkuga untundi, brain development takkuga untundi. Lot of issues happen. It is one of the worst viruses that can, infect a pregnant woman. So if ee rubella ki manandram, we would have taken a vaccine when we were children. 9 months ki istaru andaru pillalki ee vaccine anedi. But many have missed it.
Okay.
So especially in this generation, many have missed it when they were young. ఇప్పుడు పుట్టే పిల్లలకి అన్ని వ్యాక్సిన్స్ పర్ఫెక్ట్ గా వెళ్తున్నాయి. Back then it wasn't that, there was no listed things unless the parent took the child. It wouldn't happen. But 9 months ki most parents would not even like realize or remember.
Okay.
Awareness కూడా తక్కువ ఉండేది అప్పుడు. సో ఆ వ్యాక్సిన్ అవ్వలేదు చాలా మందికి. సో now we want to check, are you immune to this particular virus? So we do the antibody testing. Antibodies ఉంటే then we don't give.
Okay.
లేకపోతే ఇది ఇస్తాం. ఇంకోటి చికెన్ పాక్స్, very very common, chicken pox. If chicken pox comes in pregnancy, it causes a severe effect on the baby inside.
Okay.
Very very severe effect. So if somebody hasn't had chicken pox before, we give them a vaccine. So these are all very important. Most people are not aware of these things.
మ్యామ్, ఈ మధ్యకాలంలో ఏంటన్నా కొన్ని టర్మ్స్, కొన్ని ఇష్యూస్ గురించి ఐ విల్ జస్ట్ టెల్, యూ కెన్ జస్ట్ టాక్ అబౌట్ దట్. లైక్ ప్రెగ్నెన్సీ టైంలో బీపీ, షుగర్, థైరాయిడ్ ప్రాబ్లమ్స్ వస్తాయి. హౌ ఉమెన్ షుడ్ టేక్ కేర్ టు అవాయిడ్ దిస్, ఆర్ ఎల్స్ వస్తే ఏం చేయాలి?
సో అవాయిడింగ్ సంథింగ్ హెల్త్ వైజ్ starts from a young age. Okay, already if you are somebody who is a 65 kg woman, and you've become pregnant and you're only 25 age, for a 25-year-old 65 weight is more. So and if she has other hormonal issues like PCO, other things, then her risk of getting diabetes increases. So to prevent complications in pregnancy, your general health should be perfect again. Meaning weight maintenance, be in an adequate weight, BMI check చేసుకుంటూ ఉండాలి every year, waist circumference check చేసుకుంటూ ఉండాలి, లెగ్స్ హ్యాండ్స్ సన్నగా ఉండి మధ్యలో వెయిట్ వచ్చే వాళ్ళకి we call it as androgenic weight, obese, metabolic syndrome ఎక్కువ రావడం అనమాట. వాళ్ళకి బీపీ, షుగర్ డెఫినెట్ గా risk is little bit more. So they need to watch out for those things from before only. So I talk to women who are 20s only. You take care of your fertility from now, not when you're married, when you're above 30, when you're planning a child. అప్పుడు overnight రాదు general health. It takes years of living healthy. Then you can prevent it. Even if you're somebody who's planning next year, let's say pregnancy, start today. It is still not too late. So even a matter of 6 months or 1 year can do wonders in terms of improving general health. Junk food తినకూడదు, plastic containers ఆపేయాలి, ఇవన్నీ they're all hormone disruptors. So all these changes have to be made. Then their tests will be normal. Even if we do a preconceptional check, they should have a straightforward pregnancy. There are some women for whom diabetes comes from pregnancy hormones only.
Okay.
They will be healthy. వాళ్ళకి issues ఉండవు. Just placental hormones alone can cause diabetes. That is unfortunate. దానికి then it comes to taking care during the pregnancy. So walk during pregnancy. Don't gain too much weight in pregnancy. We allow 10 to 15 kgs. If somebody already starts at a higher weight, we don't allow even 10 to 15. We allow only less than 10. Ila. And diabetes care, obviously, we will take care during the pregnancy. They might require some tablets, sugar control ki. They might require some, insulin also sometimes. And monitor closely. You need to be in a center where there are experts who can handle maternal medicine antam dini.
Okay.
Maternal medicine is a sub-branch of maternity care. It's not there in India yet as a sub-branch, but in the UK, for some of us who have trained in the UK, we have that sub-branch as maternal medicine.
Okay.
So in maternal medicine, we treat women with medical disorders. Like women with BP, women with sugar, women with thyroid, and much worse, women with heart disease, women with chronic kidney disease, renal failure, ilantivi.
Okay.
So medical disorders with pregnancy annattu. So you need to pick a doctor like that when you're, planning your pregnancy and
Ma'am, what is AMH test?
Yeah. AMH test, most abused test this is actually nowadays. Okay. So AMH ante anti-Mullerian hormone anamata. So what this test tells is, suppose every woman has ovaries, they are born with a certain number of eggs. Right? So every month women release one egg.
Correct.
And once the eggs stop releasing, they get menopause. Menopause is period stop anamata. That is around the age of 47 to 52 in Indian women usually. So nowadays what is happening is, because of hormonal imbalances, because of unhealthy lifestyles, we are seeing that the quality of these eggs is not good.
Okay.
So AMH ante the number of eggs that are there which are capable of growing to a mature size. Every month one egg should mature and release. So some women have low AMH when they test. So general public lo discussion entante AMH మీద, AMH tells you your ovarian reserve. Agree, that is a right word, ovarian reserve. But they think that their eggs are over.
Okay.
Suppose AMH should be between the values of say 4 to 6 would be good. Suppose a woman gets AMH of 1. She thinks, oh my God, my eggs are over. I have only 3-4 eggs probably left. Ani. She starts worrying or feeling anxious about it. But that is not the case. If she improves her general health, if she had PCOD or thyroid but corrected it properly, then that 1 can increase to 2. That means the quality of the eggs is improving. That means more eggs are capable of growing and releasing. That's what this means. Fertility clinics, low fertility treatments, the minute we see a low AMH, they start, first of all, the woman starts feeling that, oh my God, na chance inka aipotundi ani. Then obviously this becomes a thing, start IVF, quick. Nak IVF, patients also ask, I want IVF. Doctors also like, yes, you have very less, AMH is very less, you also need IVF. Because the doctor won't know, ki, okay, if I tell her to go rectify her lifestyle, will she really do it and come back? If she comes back with even further less AMH, then what to do? You understood,
Correct,
right?
Correct.
That is the situation. So it doesn't mean that if you do an AMH, that's it. That is the end of your pregnancy plans if it is less annattu kaadu. You need to, we have women who have very, very less AMH also. Andardakenduku, my personal experience. I had a baby at the age of 39. My AMH was 0.04.
Okay.
But my general health is perfect. I have exercised since the time I can remember. And I've eaten healthy all my life. So it's like 0.04. Obviously, even my fertility, colleague said that, go for IVF, Manasa. Why do you want to take a risk?
Okay.
Obviously, if you see that number, you never know. I said, okay, give me 3 months, let me try. I conceived in my first trial. So it's a holistic thing. It's not just the number AMH. Do you have additional health issues? Do you have PCOD? Do you have thyroid? These two are conditions that worsen. Do you have fibroids in the uterus which are further reducing the, fertility? Suppose if you have a 25-year-old who is having less AMH, if she improves her lifestyle, her body at that age is good. She can fight whatever unhealthy things she did before. She can fight the weight also well. But if you have a 35-year-old with low AMH, then you're looking at, okay, may not happen so well, may not, let's do something quick. Then do IUI or IVF annattu. So age matters for fertility. AMH of course matters. General health matters. Hormonal disorders unnaya, that matters. Smoking alcohol matters. Everything. Fertility doesn't come from one thing. There are many things.
ఇప్పుడు IVF ట్రీట్మెంట్ అన్నారు కదా, పీపుల్ గో త్రూ 3 to 4 cycles. పోస్ట్ ట్రీట్మెంట్ వాళ్ళకి హెల్త్ ఎలా ఉంటుంది ఇంపాక్ట్?
సో IVF flow, the process of IVF is where we are giving hormones to a woman to grow eggs. And then we remove those eggs, which is called oocyte retrieval. Okay. And then we make the embryos outside, put them back in.
Okay.
సో ఈ మొత్తం ప్రాసెస్లో ఇష్యూ ఎక్కడ జరుగుతుంది, వేర్ వీఆర్ గివింగ్ హార్మోన్స్ టు ద ఉమెన్. సో వీఆర్ పంపింగ్ ఎక్స్టర్నల్ హార్మోన్స్ ఇన్ టు అ ఉమెన్స్ బాడీ. నా హార్మోన్స్ మామూలుగా న్యాచురల్గా ఒక ఉమెన్కి హార్మోన్స్ వస్తే చాలా తక్కువ క్వాంటిటీస్లో వస్తాయి. బట్ వీ వాంట్ మోర్ ఎగ్స్ హియర్ because padaka we can't keep poking a woman's tummy to get the eggs out. So we want in one cycle only more eggs. So we tend to stimulate the ovary more. So our hormones tho kondarki emavutundante they end up having little bit of risks in the future, like developing fibroids, developing PCOS. Mundu leni tarvata ravachu, kondarki mundu kuda undochu. That will become little bit more worse. But pregnancy kavalante em cheyali? There's no other option.
Correct.
You can't, overnight change all the unhealthy situation that's going on within her. ఇప్పుడు ప్రెగ్నెన్సీ కావాలి, ఇప్పుడు ఆల్రెడీ లెట్స్ సే షీస్ 35, యూ క్యాన్ డిలే ఫర్దర్. సో మనకు ఆప్షన్ కూడా ఉండదు. సో వాట్ ఐ సజెస్ట్ టు మోస్ట్ ఉమెన్ ఇస్ అసలు ఆ సిచ్యువేషన్కే రావద్దు. ఇఫ్ యంగ్ ఉమెన్ ఆర్ వాచింగ్ దిస్ ఇన్ దేర్ 20s, in their 30s, young women who are watching, take care of your health from now only, baba. Don't even reach a situation where you need to enter a fertility clinic.
Correct.
Once you enter a fertility clinic, what else there is to do? Your fertility is looking bad. So you have to intervene. హెల్మెట్ వేసుకొని బైకులు నడపండి, కింద పడి బుర్ర పగిలితే హాస్పిటల్కి రావాలి. సో హెల్మెట్ వేసుకుంటే హాస్పిటల్కి వచ్చే పరిస్థితి తగ్గుతుంది కదా. ఇట్స్ సంథింగ్ లైక్ దాట్, యాజ్ సింపుల్ యాజ్ దాట్. సో ప్రికాషన్ ఇస్ ఆల్వేస్ బెటర్.
మ్యామ్, ఇప్పుడు అబార్షన్ పిల్స్ గెట్టింగ్ ఓవర్ ది కౌంటర్, ఇస్ ఇట్ సేఫ్ అంటే వితౌట్ ప్రిస్క్రిప్షన్?
See, as a doctor, it's not safe, definitely. There are, again, two reasons why India is still selling abortion pills over the counter. Because first, the good thing I'll tell you, then I'll tell you the bad thing. See, good thing is that women are not going for septic abortions. Back in the day, మన పేరెంట్స్ జనరేషన్లో ఎవరికన్నా ప్రెగ్నెన్సీ టర్మినేషన్ చేసుకోవాలంటే అప్పటికి యాక్చువల్లీ మార్కెట్లో పిల్స్ కూడా లేవు. సో దే యూస్ టు డూ DNCs, క్లీనింగ్ ద యూట్రైన్ క్యావిటీ అన్నట్టు. అప్పుడు ఎక్కడ పడితే అక్కడ, ఎలా పడితే అలా, దే యూస్ టు యూస్, I can't even tell you the kind of things they have inserted into women's uteruses just to abort a baby. అది ఇన్ఫెక్ట్ అయ్యి, సెప్టిక్ అయ్యి, tetanus infections వచ్చి, పీపుల్ హ్యావ్ ఈవెన్ లాస్ట్ దేర్ లైఫ్. సో ఇలా జరిగింది మన సొసైటీలోనే, ఇండియాలోనే. ఫర్ కపుల్ ఆఫ్ డెకేడ్స్ దిస్ వాజ్ హ్యాపెనింగ్. Septic abortions were on the rise. So once these medicines came into the market, government decided, let's provide it to people. So that nobody has to go through these bad methods of pregnancy terminations. So that is a good thing that women have access to these things now. But the bad thing is there is too much access. They've stopped going to doctors and getting a prescription for it. Why? Because if somebody has a pregnancy, let's say, she decides that I don't want to go ahead with this pregnancy. So obviously come to a doctor first. We want to see where the pregnancy is, how the pregnancy is. You must have heard about tubal pregnancies, ectopic pregnancies. Andarki garbhamlone pregnancies tayaravavu. Sometimes pregnancies form outside the uterus in the fallopian tubes. Many women are not aware of this, especially young women. So what happens is, if without diagnosing where the pregnancy is it in the uterus, is it in the tube? If somebody just randomly takes the pills, you bought it from a pharmacy, you're taking it. If it is in the tube, it can rupture and bleed. So she will bleed internally and go into a state of shock and then come to the hospital half conscious. Ivi chaala jarugutunnai. We are seeing this mostly in young women again, 20 to 30. College crowds living alone, by themselves, away from families, and these kind of, strata of the society, we tend to see these much, much more. Okay. Medical shops are not selling now, I think. There was a point when I only used to go and just trial eddam oksari. I used to just go to a medical shop.
I think online lo Zeptos.
Really?
I think it is available.
I didn't know. I think the last I checked in a pharmacy was about 5 years ago. I would just randomly go and ask a guy, Amma abortion tablet livu ani. Some guys used to just give. I used to question them, why are you giving like this? Maakem atla rules lev madam, they say. Some guys used to not give. And now I've heard that more and more pharmacies are not giving. They are becoming a little bit strict with that. But government will, I think, not make it a serious no. Because, like I said, septic abortions. Imagine if it's a college girl who's trying to get it. They don't want to come to hospital. They don't want any record there that, that this girl has become pregnant. They don't want to get caught.
Correct.
They would just randomly resort to some, unhealthy, dangerous thing. So. They may not make a serious rule about it, but yeah.
ఇంకొక టర్మ్ లైక్ ప్రిజర్వింగ్ ఆఫ్ స్టెమ్ సెల్స్ త్రూ అంబిలికల్ కార్డ్.
Yeah.
Are these using any, అంటే ఇప్పుడు ప్రెసెంట్ మన దగ్గర యూజ్ చేస్తున్నారా మ్యామ్ ట్రీట్మెంట్స్?
Yes. It's always been, it's there. I think when I started practice 15 years back, appade kottaga this started very new, the stem cell banking anedi.
Okay.
So it was in research, then it started coming to the market around that time, like 15-20 years ago. So what this means is, now there is a baby, there is a placenta. రెండిటికి కనెక్షన్ ఇస్ ది అంబిలికల్ కార్డ్, రైట్? సో మదర్ నుంచి అన్ని బేబీకి వచ్చేది త్రూ ది అంబిలికల్ కార్డ్. బేబీ రిసీవ్స్ ఎవ్రీథింగ్, ఆక్సిజన్, న్యూట్రియన్స్, నరిష్మెంట్, ఎవ్రీథింగ్. సో ఇన్ ద ప్లాసెంటా దెర్ ఆర్ వెరీ ఇమ్మెచ్యూర్ బ్లడ్ సెల్స్ అనమాట. సో దీస్ సెల్స్ కెన్ గో ఇన్ టు ద బేబీ అండ్ బికమ్ ఎనీ కైండ్ ఆఫ్ సెల్ ఇట్ వాంట్స్.
ఓకే.
సో వీ కాల్ దీస్ హెమటోపాయిటిక్ స్టెమ్ సెల్స్. మనకు బ్లడ్లో వైట్ సెల్స్ ఉంటాయి, రెడ్ సెల్స్ ఉంటాయి, ప్లేట్లెట్స్ ఉంటాయి, క్లాటింగ్ ఫ్యాక్టర్స్ ఉంటాయి, ఇమ్యూనిటీ ఇచ్చే సెల్స్ కూడా ఉంటాయి. ఇన్ని రకాలు ఉన్నాయి మన బ్లడ్లో. సో దీస్ ఆర్ ఇమ్మెచ్యూర్ సెల్స్ విచ్ కెన్ బికమ్ ఎనీ ఆఫ్ దీస్. సో ఫర్ అ baby is in the making, na? Baby is just being made there. Baby needs all these kinds of cells. So first ఒక immature cell వెళ్ళి ఇవన్నీ మెచ్యూర్ సెల్స్ని తయారు చేస్తుంది. సో that's where this originated from. When we get the baby out, we are cutting the umbilical cord. ఆ తర్వాత ప్లాసెంటా కార్డ్లో ఉన్న బ్లడ్ అంతా కలెక్ట్ చేస్తాం అనమాట. సో దీస్ ఆర్ కాల్డ్ హెమటోపాయిటిక్ స్టెమ్ సెల్స్ అండ్ దీస్ ఆర్ బీయింగ్ ప్రిజర్వ్డ్. So that later in life, if a child or anybody in the family, the sibling or a parent also gets any disease, what kind of disease? Especially blood related disease like blood cancers. Most commonly leukemias are becoming more and more common now. బ్లడ్ క్యాన్సర్స్ కానీ ప్లాస్టిక్ అనీమియాస్ అంటాం. కొందరికి ఒంట్లో బ్లడ్ సెల్స్ తయారు చేసుకునే కేపబిలిటీ ఉండదు, జెనెటిక్గా కొందరికి అది వస్తుంది. కొందరికి ఏదైనా డిజీజెస్ వచ్చి ప్లాస్టిక్ అనీమియా వచ్చేస్తుంది. సో యూ క్యాన్ యూటిలైజ్ దీస్ స్టెమ్ సెల్స్ టు మేక్ దీస్ మెచ్యూర్ సెల్స్ అండ్ ట్రాన్స్ఫర్ ఇట్ టు దిస్ పర్సన్ హూ హ్యాస్ దిస్ డిజీజ్. అట్లా. అండ్ వీ ఆల్సో రిమూవ్ ది అంబిలికల్ కార్డ్ టిష్యూ. అంటే ఏదైతే కార్డ్ ఉందో దాన్ని కొంచెం టిష్యూ కూడా స్టోర్ చేస్తారనమాట. దాంట్లో ఏంటంటే ఇంకో రకమైన సెల్స్ ఉంటాయి, మీజెన్కైమల్ సెల్స్ అని. దీని మీద ఎక్కువ రీసెర్చ్ జరగలేదు, బట్ రీసెర్చ్ ఈస్ గోయింగ్ ఆన్. దెర్ ఆర్ మోర్ క్లినికల్ ట్రయల్స్ ఆల్సో గోయింగ్ ఆన్. నౌ దే ఆర్ కమింగ్ అప్ విత్ న్యూ థింగ్స్ వేర్ రీజనరేటివ్ మెడిసిన్, అంటే రిపేరేటివ్ అండ్ రీజనరేటివ్ మెడిసిన్. సపోజ్ సంబడి కూడా ఆస్టియోఆర్థరైటిస్, నీ జాయింట్స్ పాడైపోయినాయి, దే ఆర్ యూజింగ్ దీస్ మీజెన్కైమల్ సెల్స్ టు రీజనరేట్ ద కార్టిలేజ్. ఇవన్నీ ఇంకా మనకు మార్కెట్లో రాలేదు. ఇట్స్ నాట్ yet into clinical practice for us, but research is going on. So it is definitely useful to store stem cells, but it's expensive.
Okay.
So ఇందులో మళ్ళీ రెండు రకాల బ్యాంకింగ్, దీన్ని సెల్ కార్డ్ బ్లడ్ బ్యాంకింగ్ అని అంటారు కదా. సో ద టూ టైప్స్ ఆఫ్ బ్యాంకింగ్, పబ్లిక్ బ్యాంకింగ్, ప్రైవేట్ బ్యాంకింగ్. పబ్లిక్ బ్యాంకింగ్ అంటే అందరివి తీస్తారు, దే జస్ట్ స్టోర్ ఇట్ ఇన్ ద బ్యాంక్, ఎనీబడి హూ వాంట్స్ లేటర్ కెన్ యూజ్ ఇట్ అన్నట్టు. ప్రైవేట్ బ్యాంకింగ్ అంటే యూ విల్ స్టోర్ జస్ట్ ఫర్ యువర్ సెల్ఫ్, యువర్ ఫ్యామిలీ.
Okay.
So obviously you never know, research might become much more and it might be useful for much more things also. Or it might remain the same and treat a few diseases. When patients come and ask me, madam, ఇది నిజంగా చేయాలా, it is so expensive. Then there are two ways to think about it. One, it can be very useful. Two, what is a guarantee that your children will get those diseases only? There are only few diseases it's curing. What is the guarantee you will get those only? What if they get something else? And what if research increases more and it can cure many more things? So what I suggest is, if you can afford it, do it. So we spend money on so much rubbish. You can spend on this. Not a big deal.
And we also see so much awareness in this egg freezing. And ఈ మధ్య there are many celebrities who are saying like, freeze your eggs and do your, అంటే మీ డ్రీమ్స్ అన్ని కంప్లీట్ చేసుకోండి.
Yeah.
Kind of. So how
egg
viable
freezing,
it is, or
so egg freezing basically means that where we are removing a woman's eggs, we stimulate the ovaries, konni hormones istamu, and then we store the eggs, freeze them and store them. It's called oocyte cryopreservation anamata. So yes, you are right, one of the celebrities spoke about it and so much negative response came to that. That just tells you about the unawareness that is there in the society. So if a woman wants to wait before planning a baby, right? Like suppose she wants to focus on her career, she wants to focus on her education, maybe higher education, or she just wants to see for financial stability. What is the wrong, in that?
Correct.
So if she's someone, say in her she's just reached 30. I usually get women between 30, 31, 32, roughly in that age group. If they feel like they're not finding a partner, which is a very hard thing nowadays. So it's okay. She shouldn't have the stress about, oh my God, I shouldn't just settle with the next guy I find because I should have a baby fast. That shouldn't be the case, right? This is exactly like you tell a man to get married in his 20s. What would a man say? Why, Amma? Let me settle down. Let me become a little bit financially stable. Then I'll be able to, be a better head of the family. Right. It's a very similar thing. So it's okay. So even if the woman is aging, her eggs will still be young, right?
Correct.
So it's as simple as that. Yes, if a woman thinks that, it's not going to happen anytime soon, planning a pregnancy, she should consider egg freezing, especially in her early 30s. Because after 35, fertility declines very fast. So, what is the harm? It is expensive, agree, but, it's better than nothing.
Correct.
You shouldn't, if you come straight away to a fertility clinic at an age of, say, 37, 38, then there won't be much options left for you. Then you'll be directly, pushed towards IVF or an IUI, the success of which also will be lesser because you're still dealing with older eggs. Say if a 30-year-old came and freezed her eggs, say she comes back at 37 or 38 and says, now I want to have this baby. The embryo that is being formed from those eggs, from younger eggs, might be a healthier embryo than the embryo that will form from today's eggs. Today her eggs are much older. More genetic problems, more chromosomal disorders, more risk of miscarriages, everything. But again, it's not a guarantee that, whatever eggs are there will always lead to a pregnancy. Because again, you're adding a sperm into the picture. Now, the quality of the sperm also matters. The age of the sperm also matters. So there are multiple ways to look at it. But yes, it is definitely an option for women who want to, delay planning a pregnancy.
How is PCOS being redefined beyond just cyst on ovaries? దీనివల్ల వచ్చే మోస్ట్ కామన్ సిమ్టమ్స్ ఏంటి?
There are a lot of myths around PCOS, and unfortunately there's so much rubbish on social media about PCOS. So PCOS means basically it's a metabolic issue. Women think that it is a disease only of the ovaries and the uterus. They don't know that it's actually a metabolic issue. So PCOS occurs because whenever anyone's diet is bad, anyone is not exercising, anyone's weight is more, anyone's stress is more. All of this causes hormonal imbalance. So when there is a hormonal imbalance, there are two set of ways PCOS comes in women. One set have irregular periods, cysts in the ovaries. Those are the estrogenic PCOS type anamata. Valaki, they'll have irregular periods, they'll have fertility issues, becoming pregnant will be tough. And any women thinks PCOS is only this. But there is a whole other set of PCOS which is called androgenic PCOS. In that set of, depending on each person's body type, estrogens become more ante these set of symptoms. Androgens become more ante male pattern hormones. They get a whole different set of symptoms. Like some women just have acne. Pimples, whole lot of pimples. In an adolescent girl, you see a pimple, it's fine. But after 20s, if you're seeing very stubborn acne, which is not going away with any derma treatments, then yes, you should suspect a PCOS there. And there are some women who are just gaining weight. They're trying hard to lose, they're eating healthy, still it's not going away. That stubborn weight comes from hormonal imbalance again. Or some women is just getting hair fall. Just going on falling, no matter how much supplements you're taking, how much of a healthy you're eating. Then again, maybe it is the androgens. Some women get thick hair on their, mustache area or beard or body meeda generally excess body hair radamu. All of that is also PCOS. But they come into the bracket of androgenic PCOS. Eventually what happens is, these women don't know that they have PCOS. They just keep going to dermas and spending lakhs and lakhs on treatments. But unless they treat the root cause, hormonal cause, those things will keep coming back again and again. Eventually what happens is, any PCOS which is not cured, estrogenic, androgenic, అన్ని symptoms కలిపి వచ్చేస్తాయి as the disease worsens. So the androgenic part of PCOS profile is where always delayed diagnosis happens. They come much later. They don't even know that they have PCOS. By then their egg reserve, AMH, everything would have fallen down. So they come when they're trying to have children. They say that we are trying from so long, why are we not having? And they didn't even know that they had PCOS. Symptom బయట కనపడితేనే ఆ symptom నొక్కటి ట్రీట్ చేయడం most people do. They don't approach it holistically.
Root cause, ultimately root
yes.
cause.
So women should be very mindful about their bodies. They should know themselves first. What is happening? Am I getting... Some women are so good at that. They know exactly the day they're ovulating also. ఇప్పుడు పీరియడ్ టు పీరియడ్ మధ్యలో ఎగ్ రిలీజ్ అవుతుంది. ఆవ్యులేషన్ రోజు సమ్ అమౌంట్ ఆఫ్ మైల్డ్ టమీ ఏక్ హ్యాపెన్స్ ఆన్ వన్ సైడ్ యూజువలీ. సమ్ విమెన్ అబ్జర్వ్ దెమ్సెల్ఫ్ సో వెల్ దట్ దే కెన్ ఈవెన్ టెల్ ద డే దే ఆర్ ఓవ్యులేటింగ్ వితౌట్ ఎనీ టెస్ట్. అండ్ సమ్ విమెన్ హ్యావ్ నో క్లూ వాట్ ఈస్ హ్యాపెనింగ్. అసలు పీరియడ్స్ వచ్చినాయా రాలేదా కూడా గుర్తుండదు. 6 నెలల నుంచి వచ్చిందా లేదా కూడా దే వోంట్ నో. Nowadays we have apps for these things. You don't need to remember. Back in the day they used to say సంక్రాంతి అప్పుడు వచ్చింది, క్రిస్మస్ అప్పుడు వచ్చింది అని గుర్తుపెట్టుకునే వాళ్ళు మన అమ్మమ్మలు వాళ్ళంతా. But now we have apps to do that job for us. We use so many useless apps. This is one of the most useful app. It should be there in every woman's phone. Period trackers, flow apps, there are many names. Android ఉన్నాయి, iOS లో అన్నిట్లో ఉన్నాయి. The app will remind you if you don't get your period on time. So even if you've been busy with other things, it'll keep putting a notification. Did you get your period? Did you get your period? The minute the app reminds you, you should see, why didn't I get a period? Meet somebody about it. Ostadale, 2 months, 3 months. Okay, good. I didn't have period for the last 3 months. You should never neglect it like that. The minute your period pattern has changed, you need to see someone. In fact, if you want to be even more smarter, what I suggest is, if a woman has had, say, a 5-day period, suddenly that 5-day period has become a 2-day period, then also something is wrong. It starts off like that usually. Eventually it starts with less flow, then brownish, blackish, clotted blood, very less, and then eventually it becomes like a 2-month period, 3-month period. Nip it in the bud, catch it early. So observe even the flow pattern. These are the things that, they should be mindful of. And again, why PCOS? Lifestyle. Correct. Now there are so many things again here. Everything in your day-to-day life can cause PCOS. Suppose there's a glass bottle here. If there was a plastic bottle here, it will cause PCOS. Suppose I want to put a perfume today. It will cause PCOS. I want to put nail polish. It will cause PCOS. Everything has hormone disruptors nowadays. So, and again, ivanni kaka, they want to go and eat junk food. Every nook and corner, there is a fast food place. Nobody wants to eat healthy, organic, fresh food like how our ancestors ate. Why didn't our grandparents, grandmothers have PCOS? Because they ate healthy. They used to get fresh produce then and there. They would eat all kinds of dals, lentils, millets, make at home, eat then and there. Now what do we eat? Everything comes in a packet. Correct. Everything is adulterated. Everything has pesticides. So these are the things that are... And sugar. Our grandmothers ate sugar maybe for a festival, maybe for a birthday. They didn't even do birthdays, only festival. Now we eat sugar every day. Coffee culture, too much coffees every day with sugar and cupcakes and cakes in general. There's so many fast foods and sweet, what do you call those, cafe patisseries? Yes, so many of these in every corner. Why do we need so much sugar in life? It gives you an immediate rush. You feel happy when you eat it, and then it becomes an addiction. That's what it is.
Important tip is like lifestyle
changes. Live like how your grandmothers lived, and you'll be healthy. Okay. Some of us are doing it, which is very boring. But how else do I conceive at 39 or not? You will have benefits. You reap what you sow. One thing.
Ma'am, we also heard about endometriosis.
Yeah.
అది డిటెక్ట్ అవ్వడానికి ఎందుకంత డిలే పడుతుంది?
సో ఎండోమెట్రియోసిస్ మీన్స్ ఇప్పుడు ఎవ్రీ మంత్ యూట్రస్ లోపల ఒక లైనింగ్ గ్రో అవుతుంది. ఆ లైనింగే షెడ్ అయ్యి పీరియడ్ అవుతుంది అనమాట. ఆ లైనింగ్ ఎందుకు ఫామ్ అవుతుంది అంటే, ఒకవేళ ఆ సైకిల్లో ప్రెగ్నెంట్ అయితే దట్ ఈస్ ద బెడ్ ఆన్ విచ్ ది ఎంబ్రియో అటాచెస్. In case that cycle a woman doesn't become pregnant, that bed kind of sheds off. This is what normally should happen.
Okay.
But because of all of these reasons we've been talking about, unhealthy lifestyle, exposure to chemicals, parabens, hundreds of things, they get hormone disruption in their body, excess estrogen. So this lining starts to grow too much, and it starts to grow in areas where it shouldn't grow. We want it to grow only inside the uterus. But sometimes it grows outside the uterus. It grows in the ovary. It grows around the tubes. Rarely we have seen it grows even in a woman's lung. So when this tissue grows in wrong places, when it's shedding, suppose a cycle gadichipoyindi, period has to come. So the lining that is inside the uterus will come out as a bleeding. What about all the rest of it? If it is grown in the ovary, it will bleed there. And it will collect as a cyst, blood-filled cyst. If it is near the tubes or near the intestines and anywhere, body, it bleeds there and body tries to clear it. But clear fluid aithe body clear chesestadi. But if it's a blood, the sediment, the red sediment tends to get stuck there. So it causes structures to stick to each other. So ovaries go and stick to the uterus, fallopian tubes go and get stuck to everything, starts getting stuck to everything. So fertility becomes an issue. అలా అన్ని అతుక్కున్నప్పుడు ఎనీ టైమ్ అ ఉమెన్ గెట్స్ అ పీరియడ్, వాట్ హ్యాపెన్స్ ఇస్ యూట్రస్ ఇస్ స్క్వీజింగ్, ఇట్స్ అ మసిల్, it squeezes to push the blood out. But here what happens in endometriosis, when everything is stuck together along with the uterus, everything is moving during period, so they get severe period pain. And one more thing that happens is, this endometriosis is a invasive disease antam anamata. It burrows into the structure where it is growing. And it damages that structure. How it damages one more way is, nerve ending konta damage అయిపోతుంది. So that nerve is not able to carry the pain stimulus. They don't feel pain also sometimes. So diagnosis ఏ లేదు.
ఓకే.
అండ్ ఓవరీలో పెరిగిన సిస్ట్ అయితే కనిపిస్తుంది స్కాన్లో. దాని చుట్టుపక్కల ఉన్న బ్లడ్ డిపాజిట్ అంతా కనపడేది కాదు కదా. ఇట్ ఇస్ జస్ట్ స్టక్ ఇన్ బిట్వీన్ ఆర్గన్స్. ఇట్ ఈస్ నాట్ ఈవెన్ విజిబుల్. That is why endometriosis gets diagnosed very late. And again, gaslighting happens here also. Many women tell period pain. Periods lo andarki pain untadi kada. It's a normal thing. All women have period pain. Why are you making such a big deal out of it? That shouldn't happen. If somebody is having unbearable pain, they're not able to do their day-to-day work, that means it's abnormal. It has to be evaluated. And the other thing is, the endometriosis that is not seen on scans, how else will you see it? You have to put a camera in the tummy, do a laparoscopy, and then only it's diagnosable. Another reason why late diagnosis. There are several ways to look at it.
Any new techniques? Any new techniques now?
Unfortunately for endometriosis, there's no techniques at all. Okay. There's no other way to look inside.
Correct.
Scans show structures. They don't show if the structure is inflamed or if it is healthy. Suppose you have got a burn, light burn, and your skin became red. So it is still the skin structure only. So scan lo adi skin laane kanipistadi, red ga unnattu kanipiyadu. Correct. It is something like that. So that's how endometriosis gets missed and gets diagnosed very late. And it's one of the most horrible diseases for a woman to have, because there is no cure for it. Okay. No cure as in, you imagine, from what I explained, as long as a woman has periods, she will have endometriosis. So the only cure is menopause. Or the only cure is removing her uterus and ovaries. So what we do for endometriosis women is, whenever somebody comes to become pregnant, we do a procedure. Appadaka, whatever endometriosis has formed and grown till then, we clean it out. Remove the cyst in the ovary, clean out all the other endometriotic deposits. Then she should be able to conceive. But after she conceives, after pregnancy, malli periods start, no? Malli it will start collecting. So there are certain hormone treatments to delay the progress of the disease, but there is no full cure. Full cure is removing uterus and ovaries. So we try to push these women till 40, 45, medicines to manage chesi. When they come to 45, it's unbearable, then okay, remove the uterus and ovaries. That's the final solution, yeah.
Ma'am, are there any new age techniques for the treatment of uterine fibroids?
Fibroids, again, see, back in the day, we used to hear fibroids 1 in 100 women maybe. Now we are seeing fibroids in 1 in 20 women. In some strata of the society, 1 in 10 women also. So fibroids are becoming that common. So again, back in the day, they used to say general health check cheyalante start from above 40. Now I'm telling, do general health check for everybody, from children. So they're becoming that common. And fibroids back in the day, they used to open up. So open surgery and then remove it. So big cut on the belly. Now we are doing laparoscopic surgeries. And a keyhole surgery. No scar, no stitch. Just going through the belly button, get the fibroids out. Because if the fibroid is there, again it will cause heavy periods, painful periods, fertility issues, everything. And a tumor. It's a tumor. It's a non-cancerous tumor, but it's still a tumor. Yeah.
Ma'am, ante ippudu gut health plays any role in hormonal regulations?
Yes, to some extent. Yes, gut ante, see, your gut actually is like the center of your whole body. Correct. If you ask me. That's why they say you are what you eat. Gut microbiome is there. Microbiome means what? There are some good bacteria in the gut which help in digestion. And you inherit this microbiome from your parents. And during childbirth, after that also, what you eat, everything decides what your microbiome is. If you have done something to damage this microbiome, either eating unhealthy, like drinking alcohol, smoking, all of these are not good for your gut microbiome also. Eating unhealthy, bad food, all of this damages the gut microbiome. So your general, digestion process, everything changes. So your body is under a certain stress there. Physically, stress is not always mental. There is physical stress also. That will again cause hormonal dysregulation. It can cause hormonal disorders. So there is a connection there. But again, the root cause, eat healthy. And don't abuse antibiotics. There are so many people who viral ochina antibiotic eskuntaru. Viral ki bacteria ki enti sambandham? Viral ochina they take antibiotic. Antibiotic is for antibacteria. Viral ki antiviral untadi. So viral ki they take antibiotic. This is like e-call ki break aithe leg e-call operation cheyadam annattu. It's like that. So abusing antibiotics, what do antibiotics do? They are meant to kill bacteria, agree. But they don't know which bacteria to kill. Along with the bad guys, they'll kill the good guys also. So they're going to kill your gut bacteria also. That's why many people get diarrhea when they're taking, antibiotics. Correct. Loose motions ostai. That's not again anything bad. It's just that your gut bacteria have died. You replenish it. Meaning, take more probiotic. Probiotic ante intlo todbettina perugu. Home set curd, that is what has a lot of lactobacillus, or our fermented food like your idli batter, your dosa batter, all of that has lactobacillus. So eat those things.
మేము ఇందాక కాన్వర్సేషన్ మనకి ఎండోక్రైన్ డిస్రప్టర్స్ గురించి మాట్లాడాము. వాట్ ఇట్ ఈస్ యాక్చువల్లీ కొంచెం దాని గురించి చెప్తారా?
Very important to talk about this nowadays. Endocrine disruptors ante these are chemicals which disrupt your hormones in your body. So now in any person's body, there are hormones being released in small quantities, and these small quantity hormones do a lot of work. They are very important, and it is good that these are all working in good rhythm annattu. But we are getting exposed to hormone disruptors from the outside. So those chemicals are going into our body and they are messing up with our natural healthy hormones.
Okay.
So hormone signaling మారిపోతుంది లోపల. Body is wonderful. It works in perfect mechanism. ఇప్పుడు external hormone వచ్చి internal hormone ని disturb చేస్తే, then that signaling will get affected. Then what that hormone was supposed to do, that will not get done. So what are these hormone disruptors? What are these chemicals that are going into our body? There are like I think 5 or 6 very important ones that are there in our day-to-day life. The first and most important one is plastics.
Okay.
Plastic. Left, right, center. There's plastic everywhere. In our food, it's just in everything. Drinking packaged water, drinking everything packaged is plastic nowadays mostly, right? So all these plastics, BPA, they have BPA. So BPA is a chemical, bisphenol A. So all of this is entering your body. So this plastic will go in and mess up your system. Commonest is this plastic things. Second thing, that's why you should never store your food items or your water or anything in plastic. It should never be anything plastic if you ask me. So use steel containers to store your food or glass containers to store your food. Worst case scenario, BPA free plastic products. But again, we don't know. They will write BPA free. Who has gone and seen what they're doing? They'll just do anything for marketing.
And we use for more number of days, even though it is BPA free. Again, after 6 months or 1 year,
it should be discarded. No? But again, for us, disposable plastic is much, much more. You're buying vegetables, they're giving you in plastic, no? Correct. So carry a big bag, one big jute bag, go buy all your vegetables, put it in that. But no, everyone will give one cover. All these covers will go in our dustbin, and all those will in the garbage dump. So our soil is only infected. Our plants are growing from that. So plants are having microplastics. We are again eating those. It is never ending.
Correct.
The solution is everybody should stop eating plastic. Then maybe the soil will rejuvenate and repair itself. Then we might get some healthy food on it. That was the first thing, plastics. The second thing is your daily personal care products, like your moisturizing lotion or face creams or cosmetics. Okay, like nail polishes or anything you apply on the face. Yeah. perfumes. So all of these again are containing chemicals, parabens. These kind of chemicals are there mostly. So again, you need to limit the usage to nearly zero. First, we use a soap which dries our skin. Then we use a cream to moisturize it. It's just becoming a vicious cycle. What will be there so much dirt on the body that you need to scrub and scrub? Then they'll make some charcoal things. Then they'll make some scrubs which just gisofy your skin. It's just unnecessary. Skin has a capability to repair itself. You don't need to remove the dead cells. Dead cells will fall on their own. So by rubbing, what happens is they are just damaging more and those cells will die more. And then it just goes on and on like that. So more and more products are coming into the market. More and more people are using 2-3 layers of leave-on products on the skin. See, again, if you talk about things that you're applying and washing off, those are okay. Like your soaps or shower gels, quick apply, wash it off. So it's not absorbing into your skin more. But all these lotions or creams or whatever, no, they're staying on the skin. The ones that stay on the skin, those you should be very careful with. So read the labels. So make sure they're paraben free, make sure they're alcohol free. And it would be a good thing if everybody who's selling these products mentions everything clearly, and also mention for women particularly whether it is safe in pregnancy and breastfeeding. The minute a woman gets pregnant, then they don't know what to use. Because our products don't even tell.
Correct.
Like in countries like Japan, no, you see products, they'll tell this is safe for pregnancy, this is safe. Why aren't our people telling? Because they don't want to tell. They don't want to tell because their sales will come down.
Correct.
They want everybody to use. They don't care about their health. That is the thing. That's why to be safe, we need to make personal choices. Don't use anything. Best. You want to use some soap, you want to use scrub, use homemade scrubs come, no? With, what do you call it? Sunnipindi and all that. They make, you use coconut oil. Make freshly milled coconut oil. Ganugalo, they make, no, the oils. Use those, apply coconut oil, natural stuff. Or ghee. Make your ghee at home, apply wherever you want. That's also a moisturizer. It's a lip balm. So we need to change to these kind of things. Our ancestors lived gada without any moisturizers, face washes, charcoals and other things. Why can't we? It's doable. So the second one was this. First one is the plastics. Second is all these personal products. The third is non-stick pans.
Correct.
Left, right, center in everybody's houses. So a lot of chemicals in there. Just heating that pan only, it emits in the fumes only, it's emitting chemical. So you're inhaling that. Plus it's mixing in the food. No non-stick pan. Again, proper use steel cookware only, more than enough.
Now, అంటే ఇప్పుడు ఐరన్ కాస్టెడ్ కొంచెం పాపులర్ అవుతున్నాయి.
Yeah. Cast iron, I think they call it. Yeah, very heavy. See, we've got used to very simple, easy life. Whatever is easy is not safe. Those cast iron ones are a little heavy.
And it takes time to...
It takes time to heat. So, see, anything that's an easy way route is coming with some complications. You need to work a little bit hard in certain areas. So, that is one thing. There are many more. Pesticides. Pesticides and herbicides. Again, see, we are thinking that we're eating healthy with green leafy vegetables and all. We don't know what... Soil is contaminated in the pesticide. The water is contaminated with chemicals. They put bleach, no, and everything.
Correct.
So, if we really want to live 100% healthy, we need to go far away from civilization, find 1 acre of land, grow our own fruits and vegetables and eat. Have our own cows and chickens and eat healthy. That's the only...
And this like room fresheners, detergents.
No, nothing. All fragrances are hormone disruptors. So your room fresheners, your perfumes, everything again. Better to avoid.
Okay. Ma'am, next topic is like, at what age women start seeing premenopausal age? I mean, symptoms.
So in Indian women, menopause ranges somewhere between, I said 47 to 52, right? It's not always the same year for everyone. It depends on their genetic body type and everything. So before that menopause comes only, there is something called as a menopausal transition.
Okay.
So say about 7 to 10 years before that only, hormones start changing.
Okay.
That is called the transition phase. Most women feel the transition most in the 2-3 years before the menopause comes. So when the transition happens, your hormones change again. So some women have symptoms, some women don't have symptoms in that transition phase, but your body feels different. So just, do some meditations, do some exercises to keep yourself fit so that you're strong enough to handle that transition. But some women have irregular periods. Some women have early periods coming. Some women have very late periods coming. Some women have very heavy flows. So different women react differently to this menopausal transition. There are solutions for this. It's not the worst, but you should not use hormones again. So what happens is, menopause means what, your ovaries are shutting down. So no estrogen is coming into your system. So they can, have all of these hot flashes and sometimes mood swings, and sometimes you feel weak, you feel less energy. All of this can happen, but you should just allow your body to cope with these changes. So, but some women, when they feel like, oh my God, I can't bear this at all, then there are certain treatments. There are non-hormonal treatments which are safe to use. Hormonal treatment are also there which are not safe. But some people want quick results, like Swiggy, Zomato service. So then they resort to hormonal treatments which are not safe. You should not break your body's natural rhythm. Do other mechanisms to cope with it.
And many ignore also.
Many ignore. Many women ignore. See, back then there was no knowledge about these things. So women used to just bear with those things. Usually 1 or 2 years, then it starts feeling better. Heavy bleeding women used to just end up going for hysterectomies because otherwise they would become anemic. But now we have other treatments where we don't need to remove a uterus. We can just reduce the bleeding. Back in the day, there weren't all those treatment options. And even these hot flashes and all, they would just bear with it. They would just take cold water baths or something like that. They would do and manage. But now the sensitivity is more for anyone nowadays. They've become more sensitive to symptoms. Small thing also, they want to, take some hi-fi treatments and all that. They don't do conventional home remedies first. They want to resort to too much medication. That should be avoided. But it's doable. Nobody needs medications actually. You have other methods to fight it.
Ma'am, you have seen too many patients. Like, what is most heartbreaking or else any disturbing cases you've seen recently?
I get disappointed every day. The first thing that disappoints me is unawareness. Like, I see 100 kg woman. She comes to me and she says that I have acidity. Yes, I will give you the medicine for acidity. But what about the 100 kg? You're not even thinking about it. You're not even addressing it. Then some of them even get offended when we talk about their weights. See, when a doctor talks about weight, it is not offense. It is awareness. It is health education. So we want to tell them, we want to focus more on preventive medicine. Curative medicine is anyway there. That we will anyway do. We've trained for years to do that. But we want to now, I personally want to do more of preventive medicine. Don't want any women to get any hormonal issues and all of that. So that's very disappointing that they are not aware themselves. We have so much social media. There's everything out there, but they see only the bad things. The good thing doesn't reach anybody only. It's only the bad things that are marketed very well and they reach everybody. If people start becoming more mindful, suppose, we don't want anybody to eat packaged food. That's another hormone disruptors. Packing it in a plastic container, canned foods and all of that. We don't want anybody to eat it. If you and I stop buying those foods, the fellow who's making it will stop making it.
Correct.
Then he will start making the safe stuff because he knows that that's where the money is. How will it happen if everybody is aware? So that non-awareness is something, which is why we're doing all this, right?
Correct.
To bring awareness to people,
Did you ever face any patient with prefixed mind with knowledge of social media?
Oh yes, every day.
So how you
now it's not just social media, we're talking about ChatGPT.
Yes.
So what my patients are doing nowadays, it's really interesting. I do spend more time with those patients. They kind of put their symptoms in a ChatGPT. They make their diagnosis. ChatGPT gives the possible treatments also. And they'll come to me. Okay, now they're trying me. Okay, testing me rather. So they'll come and they'll just tell the symptoms and I've come to a diagnosis, and then I'll say, okay, these are the medicines you take. Then they'll ask me, it could be that also, no? Because ChatGPT would have given 3-4 diagnoses and given many treatment options. So then they'll ask me, why is not that condition the case here? Why you're not giving me that medicine?
Mm.
So my diagnosis and my treatment is over in 5 minutes.
Mm.
The rest of the 20 minutes goes in why it is not all the other things.
Mm.
Simply breaking their head. See, if you put headache in Google or in ChatGPT, it will tell you even brain cancer.
Mm.
Because even if you're tensed, you'll get headache only. Even if you have brain cancer, you'll get headache only.
Mm.
How will that ChatGPT know who the hell is putting this in the message?
Mm.
So that's why we tell, don't simply stress yourself more with those things.
Mm.
There obviously, if I see you in person, I know what exactly is going. Walking into the room only, I can tell which woman has PCOD nowadays. Because you can see the skin pigmentation, you can see the acne, you can see the hair growth, you can see the waist circumference. And there are many patients who are in denial. You tell them you have thyroid. No, doctor, I don't have thyroid. You tell them to take tablet. Oh my God, if I start, I have to take all my life. Then they don't take it. It's okay to take it all your life and keep it under control rather than making it worse and causing more complications. So we see all kinds of people. All kinds.
అంటే లైక్ ఇఫ్ ఎవరైనా మీ దగ్గరకు వచ్చినప్పుడు లైక్ దే ఫీల్ దట్ ఐఎమ్ వెరీ మచ్ ఓకే బట్ ఆఫ్టర్ సీయింగ్ రిపోర్ట్స్ దెర్ ఈస్ సంథింగ్ ప్రాబ్లమ్ ఇన్ దేర్. అంటే హౌ యూ విల్ దే యాక్సెప్ట్ డైరెక్ట్లీ?
Mostly with this thyroid only, they don't accept. Like many women don't accept. Again, there are some people who accept also. See, we're talking about 100 different people. Everybody's mindsets are different. Everybody's personality is different. Everybody reacts to us in a different way. So with years and years of talking to them, we've also mastered how to address each kind. So we tell them, then we have to explain to them. If they say, no, this is not right, this may not be my report. Then we have to tell them, this is, why this is. Then they'll go and talk to 5-6 other doctors to confirm it. So there are people like that also. Okay, go. It's okay. As long as you're at least trying to, make sure you have this and start your treatments, it's fine.
Ma'am, we'll talk about these myths. Like during pregnancy, papaya or else or taking saffron.
Yeah.
And there are some post
delivery myths also.
Myths also.
There are hundreds and thousands of them.
So దాంట్లో ఎన్ని మిత్ అంటారు, రియాలిటీ ఎంత?
See, let's talk about papaya, like you said. Papaya came from nature.
And even pineapple అనుకుంటా.
Pineapple కూడా.
Yes.
I don't know why these fresh, natural, organic foods have become villains. Every pregnant woman is asking me, can I eat papaya? Can I eat pineapple? They will never ask me, can I eat Lay's? Can I eat cupcakes? That they'll not ask. They'll go and eat directly. These they'll ask. Because so much myth has come from generations. Grandparents are telling. Why? It doesn't do anything. In one sentence, if I have to say something, all natural foods are safe. Anything coming fresh from nature is 100% safe. It doesn't do anything. Anything coming packaged with a preservative can cause harm. Because that became a chemical, no? Again. Even if you... So, see, papaya lo, the myth was that it will cause abortion. So, when there is a raw papaya, the green one with the white oozing out of it, it has some latex in it. So, they say that latex can cause uterine cramping, which can cause abortion. First of all, nobody eats a raw papaya. Okay?
Right.
So, ripe papayas are very, very healthy. They have antioxidants. They have a lot of, vitamins, minerals, everything. Why would you first of all eat a raw papaya? And even if you have eaten, the amount of whatever that latex comes in, an amount of spasm it will cause on your uterus is barely anything. Your uterus is probably already spasming that much. In early pregnancy, right, in the first 3 months, some women feel period-like cramping because your uterus is cramping. It doesn't know newly what is this new thing growing inside. It sees it as a foreign body first. So initially, first 2 months, there are some cramps experienced, which is normal. A pregnancy that is healthy, genetically healthy embryo which has formed and attached well to the uterus will not abort with anything. If it is a genetically, chromosomally abnormal embryo, even if you don't eat anything, lie on the bed 24/7 also, it will abort. It is incapable of growing. So they should not, and again, check with your gynecologist before you resort to certain things. Like there was one woman, somebody told her barley water is good. So she just drank bottles and bottles of barley water every day.
Mm.
See, if you drink barley water little bit, it will hydrate you.
Mm.
Excess, it will cause diuresis. It will wash out the water out of your system.
Mm.
So she drank so much that the fluid around the baby became less.
Mm.
Why? Even these, see, again, this is a natural thing. Barley, technically, you would, again, like I said, natural things should be safe. But overdoing anything is, again, not safe. Everything in moderation.
And some women periods రావడానికి కూడా papaya తింటారు.
It never works.
Okay.
Patients come and tell me, doctor, I didn't get period for 3 months. I ate papaya also, they'll say. Okay. I just tell them, what, did it work? It doesn't do that. And even if it does, it was probably going to come anyway. Maybe just a coincidence.
Okay.
So, yeah.
And even, అంటే ఇప్పుడు అంటే ప్రెగ్నెంట్ ఉన్నప్పుడు స్టమక్ షేప్ చూసి బాయా గర్లా అలాంటివి కూడా
there are so many like that, and they're all over Instagram. They put a picture of that. If the baby is up, I think it's a girl. If the baby is down, it's a boy or something. No, yes. See, first of all, organs are the same for everybody. How the shape of the belly depends on the shape of the person. First thing. So we see some very skinny women who have a very narrow pelvis, narrow structure, body structure. So for them, it can look a little bit big, the tummy. Suppose we have a woman who has a little bit bigger personality, a bit wider pelvis. For them, it might not look so much. Asalu potte kanipichadu ani antaru vallu. That is one thing. The second thing is, it also depends on the tone of the muscle. Women who have been active before, physically active, like exercising, who have tough abs. For them, as the baby is growing, the uterus doesn't fall forward. Because you have a nice tough muscle. It's holding it in place. So uterus will grow upwards.
Okay.
And after their delivery also, because they have such a nice strong muscle, it will recoil. They won't have a hanging belly. But somebody who has never worked out their entire life, if they already have a loose belly to begin with, once they become pregnant, uterus is growing. Uterus is attached only down to the pelvis. All the top part will fall forward. And then belly comes out.
Okay.
Then they say it's a boy, huh? It just means loose muscle, babe, go to the gym. That's what it means. Yes. So, and then after the delivery also, they end up having a belly. Big one. Little belly everybody will have, but they'll have a bigger, looser one. Which is very difficult to recoil back and get it back into shape. So, people should work out from before only, make sure they have tough, toned abs. You see women who work in fields, polam panlu, construction workers, they'll have 3-4 children, no belly. Just observe, okay, when you look outside, these things you'll see every day. I just go to a mall, I look at I can see PCOS, thyroid, like that it's become now. It's like, they have such toned muscles. Because farm workers, they bend, they get up. Even those who do household work, right? They wash clothes, they wash their dishes, sitting, getting up. Our grandparents who did a lot of the sitting, getting up, they don't have that much of abs. Now in 30s only we are seeing, very loose bellies and all. Because we have sedentary lifestyles. We're just sitting all day.
Ma'am, any product suggestion for new mothers and pregnant women?
So pregnancy products, again, see, your washing off products, you can use anything, it's fine. Like your face washes, body washes, shampoos and all, anything is fine. But leaving on products, there you need to be careful. As much as possible, none. Okay? Or you can use your natural ones, your ghee or your coconut oil. Coconut oil is the best moisturizer.
And the problem is people are like blindly following social media.
Yeah, I know. Nobody follows me. I am putting so many videos, I barely have any views. If some idiot will put girl here, boy here, they will get millions of views. So, what to do? This is the way it is. But see, with the products, again, people are worrying about stretch marks too much. So, to prevent stretch marks, they say stretch mark cream. Patients ask me, doctor, give me a stretch mark cream. First of all, there is nothing like a stretch marks cream. They're all moisturizers only. He will just write stretch mark cream so that he can sell more.
Okay.
There's nothing like a stretch mark cream. So it's like, use coconut oil if you want to moisturize. I personally used coconut oil. every single day in the night. Daytime I usually didn't moisturize only. First of all, we keep washing 100 times in the hospital, and we don't want to put anything on our skin because it sticks more fomites. So surgeons, we never apply creams on our hands especially. So I avoided using any creams. I suggest this as the first resort. But if you're somebody who's having really dry skin, pregnancy hormone itself can cause dry skin for some women. And especially when the stretch marks come, they tend to itch a lot also. So then you need a soothing cream again. So you can use lactocalamine, Cetaphil, these kind of things.
Okay.
So these are a little bit safer. Night when you're at home, you're not worried about the oiliness, use coconut oil. That's all.
Baby products, ma'am?
Baby products again, none. None. So for babies, what do you use usually? Again, the soap and the shampoo, I'm not worried about that much because you're washing it off. And hopefully the baby soaps and shampoos are using less chemicals. When you're reading the labels, look for alcohol free, look for fragrance free.
And many baby food lo sugar chala untundi.
Oh yes. Coming to that. So now for babies, lotions. I would say again, you can use pretty much, see, why will they have that much dry skin, babies? So don't be too harsh with their bath and everything. So for moisturizing or for massaging, you can use your milk cream. Very few babies get allergy to that, but it's very unlikely. Start first with a little bit on the feet. If you see that there's no allergy, then you can use milk cream only. Freshly, you're boiling milk every day in the house. It'll give a cream. Use that to massage the baby and then wash off with some mild soap. That's enough. Then you don't need to put any creams. But in winters, what happens is baby's skin is very thin. So they get kind of eczematous skin changes and what. There you need a lotion.
Ma'am, అంటే ఇప్పుడు పుట్టిన బేబీకి కాటిక పెడతారు, full rub చేస్తారు.
Make them like Kalimas. They'll put everything under the eyes, so far here. It's unnecessary. And see, back in the day, they used to make that that kajal with some natural ingredients. But now we're getting again all synthetic marketed stuff. Not to use. Don't put. Why? Why does a baby need that Kalima appearance? Not necessary at all. Don't put. And then they poor things, they'll rub it, it'll go in their eyes, it'll go in their mouth.
Massage, like head massage చాలా గట్టిగా చేస్తారు.
Head massage, there's one thing I heard. I was told from some old people that squeeze the baby's head so it becomes round.
Okay.
Because babies tend to have a little bit conical head when they're born. Because when they're coming through the pelvis, the head takes a little long shape.
Okay.
Babies have very thin, flexible, squeezing skull bones so that they can fit through the birth canal and come out. So in the process, babies' heads become a little bit long. So they say that after the baby's born, you press it like this and make it round. It's not a football or a pappa mudda you're making over there. Okay. As the baby grows, it will round out. So by around 8-9 months, brain development becomes very, fast and things. Eventually, it becomes round. They'll get the shape they were meant to get anyway. So you should never press. It can cause a lot of pain. And how will the bone move from pressing? Just hand to ila press cheste shape maaripotuda. It's not a maida pindi. It doesn't happen that way. And also they say that you put the baby on a pillow with grains in it. What do you call that? Mustards. They put mustard in a pillowcase and then they put so that the head doesn't flatten out. It'll still be round. And none of these things work. So if you don't want the baby to get a flat head from lying down like this for too long, keep changing the position of the head. Let baby turn this way. Sometimes baby sleeps sideways fully. So you can try those things, but just don't squeeze around the head. And even these grain pillows, those grains absorb a lot of heat. So you're just heating up the baby's brain unnecessarily. Better not to use anything.
అంటే వై ఈ ప్రోడక్ట్స్ అన్నిట్లో ఈ కెమికల్స్ని ఎందుకు పేరెంట్స్ చూడట్లేరంట? లైక్ వై గవర్నమెంట్ ఇస్ అలౌయింగ్?
Marketing strategy. Marketing has become so excellent nowadays that they convince you that this is exactly what you need and without this you can't do. And then everybody just feels like, oh my God, I can't do without this. I need to do this.
And there is one almond syrup issue.
Yeah. See, almond syrup issue, don't even get me started. See, this is not just with almond. Almond thing came out. There are so many probably that are not coming out. Use medications as less as possible as a last resort and prescribed by a doctor. No self-medication ever, especially for children. And unfortunately, in our country, let's say this publicly, there is no safety regulation with anything. There's no safety regulation with food, with products, cosmetics, and with medicines. Anyone bribes a politician, they will get their way. That's just the unfortunate society we are in.
Ma'am, being a doctor, how is your work-life balance?
Very bad. It's very difficult to get a work-life balance for us. I am lately doing better, but see, what we become like as the minute we finish from our MD, as doctors, we want to build our career, just like everybody else in any other career. So we end up working a lot. And our jobs are very physically takes a toll on you and mentally also, because you're thinking about every case. So it's like,
I think in your case, you can't delegate to some other. You should do.
You can't. We even if we can, we won't. Because where is the satisfaction then? Then I'll be like, if I have to give my case to someone else, I have to think 100 times if I'm giving it to the right person. If I'm going out of town, then there's only one particular colleague I can fully trust my patients with. Because then that responsibility comes that, I should have done something better. I didn't do a good job. What is the point? So that is what takes a toll for us. So if in the initial years, most doctors kind of neglect their health and, they're just worried about the career building and everything. Once we reach a certain stage, then we first of all stress less because we're not in that learning phase now. Now our experience is better. We can do things without mentally stressing. But physically, we need to limit our hours. If I'm doing surgeries 9 to 4, then I'm okay. If I'm doing surgeries 8 a.m. to 8 p.m., then it will take a toll on me. So that is where we need to also be a little bit mindful and this thing. So this is just my own experience. I used to work 8 a.m. to 8 p.m. till about 2 years ago. So when I started planning my baby, then I was like, okay, now I need to reduce the stress. That's when I gave up a little bit of work, stuck to only 9 to 4 and then, did it. I'm sticking to that even now.
And దీంతో పాటు డాక్టర్స్ కి లైక్ పేషెంట్స్ నుంచి ఈ మధ్య చూస్తున్నాము పేషెంట్స్ ఆర్ డైరెక్ట్లీ అటాకింగ్ డాక్టర్స్.
సాఫ్ట్ టార్గెట్స్.
సో అంటే మీరు ఇంత కష్టపడిన తర్వాత ఇంత చేసిన తర్వాత ఇలాంటివి జరుగుతుంటే హౌ డు యూ ఫీల్?
See, initially in my initial years, I used to get affected a lot. I used to feel that I did so much and it was just for nothing. And then I realized that I'm in a selfless profession. Whatever I'm doing is for the others, not for me. So then it became easy. So that's what all doctors should think like. We are in a selfless profession. So after a point, you should not bother about what they're thinking. You cannot 100% satisfy 100% of the people. There are always different mindset on people. People scream outside my door sometimes because they have to wait for 15 minutes. Everybody wants Swiggy, Zomato service. How will that happen? Suppose I had appointments booked and then I got one emergency. How will we guess that? How will the receptionist guess that? So we'll go quickly do the surgery and come back. It'll take an hour. By then, it would be one World War III over there. They'll be screaming out of their lungs and poor PREs and receptionists will, get all the beating. And but see, they should be more mindful about things. It's like it happens. They should be understandable and they should keep some time and come. Like they say that my appointment was 11:10. I want at 11:10 only. It cannot happen because one patient might take 10 minutes with me. One patient might take 30 minutes. If a patient is seeming very anxious to me, I want to spend more time with her. I can't just give her the treatment and send her. I want to talk more to her. I want to calm her down. Otherwise, what is the use of her coming to me?
Correct.
I don't want to just give them medicine. I want to approach it holistically again. So that patient might take a little bit more longer. So that 11:10 may not be 11:10. It might become 11:30. Little bit flexibility should be there.
Do you suggest your next generation to become a doctor?
Yes.
Nice.
Yes, one of the very, very few doctors who are saying that, next generation should be. But again, see, every profession has its pros and cons. Doctors are soft targets, agree. We have taken beatings, we have taken many things. So it's like, I think when I was in my MD final year, this is my personal experience, we were in the emergency room. It is a medical college when I was in MD. Emergency room, one patient, road traffic accident came and he died. Everything was tried, resuscitation. So emergency physician was there, general physician was there, surgeon was also there in case some surgery needs to be. Everybody was there. We were all on duty. And I was there, gynae, for some other case. So this person died and that the family just lost it. Agree that they are coming from an emotional, area, and they are not able to digest the fact that they just lost a family member. But some people can't handle their emotions too well. They started beating everybody every doctor, every nurse that day in the emergency got a beating. So you can't help it sometimes. So I get so angry when I see these news sometimes. No cigarette dagnappudu, no mandu dagnappudu nenu vachi kodutunnanu. Fine, bhai, I'll go to a pub, I'll beat everybody who's drinking alcohol. You don't beat me then if I'm not beating you. So sometimes that anger comes, but then you can't help everybody, like I said.
Ma'am, do you think there should be any change in syllabus or curriculum in India for doctors?
So, curriculum change, if you ask me. See, I got trained in India also. I got trained in UK also. So, from my personal point of view, I saw a hell of a difference. So, in Indian colleges, right, there was more of learn on your own kind of a thing.
Okay.
Back when I studied, it was still better. Professors used to take classes, but gradually that is reducing more and more. So, you're just on your own, reading your books and learning on your own. And that happens even in the West a little bit. You can't take classes like you take for a class 2 or a class 5 student. Like you can't take like that for doctors. There's a lot of self-reading and self-education there. But there need to be protocols in place when it comes to medico-legal issues. So that is where we need protocols. General clinical practice, it will go on well. That is not an issue. But medico-legally, like see, Telangana is showing highest rate of cesarean deliveries. It has been in the news for the past 3-4 years. So in 2022, when this came up, I think our health minister kind of questioned the authorities, the DMHOs and district medical health officers. What is happening? Go check in every hospital what they are doing. So they actually came to every hospital and they started questioning why so much cesareans are going on, why this is happening. So now they said that you guys, all doctors have to fill a form stating the patient's name and why you did a cesarean for her. This is still going on. It started in 2022. So at that point, district medical health officer, I was the head of department in one teaching institute. So we were training students also. So when we are training students, right, MDs, we have clear treatment protocols because we want everybody to follow a uniform treatment protocol. So that we had. So that particular year when the DMHO came, we were showing the highest normal vaginal deliveries in Telangana. We actually got an award for it. But why aren't, he came and asked that this is not even an expensive hospital. What are you guys doing differently? I said, we are following protocols.
Okay.
Everybody should follow protocols. That's it. Putti gynecologist lai vachama pottalo nunchi. We learned later. So everybody needs to just learn that. But that year when they gave these forms, right, they started seeing there is one sector of patients where they have undergone cesareans for failure to progress and antam. There is a terminology where the labor didn't progress adequately. So is it 2 hours you wait to call it failure to progress, or is it 10 hours you wait? There's no guidance there. Clinically, there is a guidance, but medico-legally, there's no guidance. Suppose something happened, if a patient was in labor for 10 hours and then she didn't deliver, and suddenly we saw the heartbeat dropping and we went and took her for a cesarean. Then when it comes to, if that patient wants to sue us and it goes into a, court, lawyer's court, then the law doesn't know what they should see. Did this doctor do the right thing or did they not do the right thing? Andalo protocols live. So if the medical protocol says that every doctor should wait for so many hours at every stage of labor to say that it is a failure to progress, then everybody follows the same thing. Then you can pick, okay, this doctor did the right thing, this doctor did the wrong thing. Now that is not what is happening. Now how law is deciding things. They see how much damage happened to the family. దాన్ని బట్టి verdict ఇచ్చి వాడికి కొంత మనీ ఇస్తే patient is satisfied. That is not what we want. There was a case recently in one of the very reputed hospitals in Hyderabad where a baby developed cerebral palsy. Labor went smooth. There was no complication anywhere. Baby's heart rate was perfectly good all throughout. But for some reason, after delivery, baby developed cerebral palsy. And cerebral palsy is a debilitating condition. So the child needs care continuously by the parents. Okay, the child might even be like wheelchair ridden or things like that. So the court punished the gynecologist who did the delivery for almost 1 crore or something. Why? Fine, the doctor might be having insurance. But why? This is a very, very senior doctor who I also look up to. And her paper was all over the news. I mean, her name was all over the news. And, there is so much defamation for something that went. Did the court even look at the case sheet? Did they see what the doctor did, what medicine was given when? Did they check with the authority of the gynecology, which is a FOGSI, Federation of Obstetrics and Gynecological Society of India? No, kutundi. Did they check? No. Patient got damaged, give money. So nobody is in our favor. So when this question came, why high caesarean rates? Of course, doctors don't want to take a chance, even the slightest chance.
Correct.
So our way of practice is only changing there. Who can you blame? So here in this area, I need protocols.
Yes.
Since you asked me, it went into that. Yeah.
Ma'am, we'll end up with one last question. What does a holistic gynecology appointment should look like in 2026?
So in 2026, for all gynecologists, I want to say that don't just give medicine to your patient. Tell them preventive care. What they should eat, what their physical activities should be, and what symptoms they need to watch out for, and when they should approach a doctor. These 4 things should happen. And then we can prevent many diseases.
Thank you, ma'am. Thank you so much.
Thank you.
I think we talked about so much.
A lot.
Technical
Yeah.
aspects.
Yeah.
Thank you, ma'am.
Thank you.